Top 25 NHS Healthcare Assistant Interview Questions and Answers. If you're preparing for an NHS Healthcare Assistant interview, this video is exactly what you need. In today's guide, we'll walk you through the top 25 most common interview questions, along with detailed, professional, and conversational answers that will help you stand out. Whether you're applying for your first HCA role or moving within the NHS, these answers will give you the confidence to impress any panel. So grab a notebook. Let's get you interview ready. 1. Tell me about yourself. When answering, focus on your healthcare experience, empathy, and teamwork. Example: I'm a compassionate and patient-focused person with a strong desire to help others. I've worked in care environments where I supported patients with daily needs, monitored vital signs, and maintained a positive attitude even under pressure. I enjoy working as part of a team and understand the importance of communication in healthcare. My main motivation is improving patients' comfort and well-being. I'm excited about joining the NHS, where I can grow and contribute to patient care every day. 2. Why do you want to work for the NHS? Show your motivation and values. Example: I've always admired the NHS for its dedication to providing free, high-quality healthcare to everyone. Working here means being part of a respected organization that puts patients first. I want to contribute to that mission by offering compassionate, person-centered care. The NHS also provides great training and development opportunities, which means I can continue learning while making a real difference in people's lives. It's not just a job for me, it's a chance to serve my community. 3. What does a healthcare assistant do? Demonstrate understanding of the role. Example: a healthcare assistant supports nurses and other professionals by assisting patients with personal care, monitoring vital signs, and ensuring comfort and dignity at all times. HC is also help with feeding, mobility, and recording patient information. Beyond the physical tasks, it's about emotional support, listening, showing empathy, and being observant. A good HCA notices changes in a patient's condition and communicates them promptly. Essentially, we're the bridge between patients and the wider care team, ensuring smooth, compassionate service. 4. How would you handle a difficult or aggressive patient? Show empathy, calmness, and professionalism. Example: I would stay calm and avoid taking things personally. Often, aggression stems from fear, pain, or frustration. I'd speak in a gentle, reassuring tone and give the patient space while ensuring their safety and the safety of others. Once the situation is under control, I document the incident and reflect on what triggered it to help prevent future occurrences. Compassion and communication are key. 5. How do you ensure patient dignity and privacy? Highlight compassion and respect. Example: I always treat patients with the same respect I'd want for my loved ones. That means keeping them covered during personal care, closing curtains or doors, and asking for consent before any action. I avoid discussing their details in public spaces and use a gentle, reassuring manner. Dignity isn't just about privacy, it's about recognizing the patient as a person with emotions, choices, and independence. I also encourage them to do what they can themselves to maintain confidence. 6. Describe a time when you worked under pressure. Focus on teamwork and composure. Example: in my previous role, we were short-staffed during a busy shift with multiple patients needing assistance. I stayed calm, prioritized urgent cases, and communicated clearly with my team. We divided responsibilities efficiently, ensuring everyone received care. Despite the pressure, we maintained professionalism and patient safety. I learned that staying organized, supporting colleagues, and focusing on solutions make all the difference. It reinforced my ability to remain effective even in high-stress situations. 7. How do you maintain infection control standards? Mention hygiene and NHS procedures. Example: I strictly follow infection prevention policies by washing hands before and after every patient interaction, wearing appropriate PPE, and properly disposing of clinical waste. I also clean equipment and report any contamination risks immediately. Infection control protects both patients and staff, so I take it very seriously. I stay updated with training and encourage others to follow best practices too. Small actions, like sanitizing bed rails or wearing gloves properly, can save lives in a healthcare setting. 8. What would you do if you noticed a colleague not following protocol? Show integrity and professionalism. Example: I would first ensure patient safety isn't at risk. Then, depending on the situation, I'd speak privately to the colleague to remind them of the correct procedure. It could be a genuine mistake. If the issue continued or was serious, I'd escalate it to a senior nurse or manager, following NHS whistleblowing and safeguarding policies. It's important to maintain professional standards and accountability, because patient safety must always come first. 9. How would you handle a patient refusing care? Balance empathy and policy. Example: I'd listen to the patient calmly to understand why they're refusing care. Sometimes fear or misunderstanding is behind it. I'd explain the benefits and reassure them without pressuring. If they still refuse, I'd respect their right to make that choice, document it accurately, and inform the nurse or supervisor. Every patient has autonomy, and it's our duty to provide information and support, not force decisions. Respect builds trust and helps future cooperation. 10. How do you manage confidentiality? Show awareness of data protection. Example, I treat all patient information as strictly confidential. I only share details with authorized team members and never discuss patients outside professional settings. I understand the importance of GDPR and NHS confidentiality policies. Patient trust depends on knowing their information is safe with us. Whether it's medical notes, verbal updates, or electronic records, I always ensure proper handling. Confidentiality isn't just a rule, it's an ethical duty in healthcare. 11. Describe your communication style. Show empathy and clarity. Example, my communication style is clear, calm, and compassionate. I adapt my tone depending on who I'm speaking with, patients, families, or staff. With patients, I use simple language and active listening to ensure they feel heard and understood. With colleagues, I'm concise and collaborative, especially when passing on important information. Good communication prevents misunderstandings and improves patient outcomes. I also use nonverbal cues, like eye contact and body language, to show empathy and attentiveness. 12. How do you support patients emotionally? Demonstrate empathy and patience. Example, I provide emotional support by being present, listening, and showing kindness. Many patients feel anxious, lonely, or scared, especially in hospital settings. I make time to talk, comfort them, and reassure them about their care. Even small gestures, a smile, holding a hand, or remembering their name, make a huge difference. I believe emotional care is just as important as physical assistance. A calm, compassionate presence helps recovery and builds trust. 13. What does person-centered care mean to you? Show understanding of NHS values. Example, to me, person-centered care means treating each patient as an individual with unique needs, preferences, and values. It's about involving them in decisions, respecting their choices, and focusing on what matters to them, not just their medical condition. For example, if a patient prefers a certain routine or food, I try to accommodate that when possible. It's about dignity, empathy, and teamwork to provide holistic care that supports both physical and emotional well-being. 14. How do you handle working long shifts? Show resilience and positivity. Example, I plan ahead by staying hydrated, eating properly, and managing rest before and after shifts. During work, I pace myself, take short breaks when possible, and keep a positive attitude. I also support colleagues to share the workload. I understand healthcare isn't a 9-to-5 job, it requires dedication and flexibility. What keeps me going is knowing that my work genuinely helps people. The sense of purpose outweighs the tiredness. 15. Describe a time you worked as part of a team. Show collaboration. Example, in my last role, our ward had a patient who required constant monitoring. I worked closely with nurses and fellow HCAs to rotate responsibilities. We communicated through handovers to ensure continuity of care. Everyone contributed ideas to improve comfort and safety. The teamwork was seamless. We supported each other and built strong trust. That experience taught me that collaboration leads to better care and a more positive working environment for both patients and staff. 16. How do you deal with stress at work? Show emotional control. Example, when I feel stressed, I take a moment to breathe and prioritize tasks calmly. I remind myself that staying composed helps patients and colleagues feel reassured. I also talk to my team. We support each other during busy periods. Outside work, I manage stress through rest, family time, and exercise. Working in healthcare can be emotionally demanding, so self-care is important. A balanced mindset helps me perform well and stay compassionate. 17. What would you do if you made a mistake? Show honesty and accountability. Example, if I made a mistake, I'd immediately report it to a senior member of staff and document it according to policy. I believe in taking responsibility rather than hiding errors. Mistakes can happen, but how we respond matters most. I'd reflect on what went wrong, seek feedback, and learn from it to prevent recurrence. The NHS encourages a culture of openness, and I believe that's essential for maintaining safety and trust. 18. How do you prioritize your workload? Show organization and awareness. Example, I assess which tasks are most urgent and important, like responding to a patient in distress or assisting with medication rounds. I use handovers and care plans to guide my priorities. Communication with nurses is key to staying aligned. If new situations arise, I stay flexible and adjust. Prioritization isn't just about speed, it's about safety and attention to detail. By planning ahead, I ensure every patient receives proper, timely care. 19. What do you find most rewarding about this job? Show passion and empathy. Example, the most rewarding part is seeing the positive impact I can make in someone's life. Helping a patient regain confidence, smile, or feel comfortable makes every challenge worthwhile. I love being part of a team that supports healing and recovery. It's not just about tasks, it's about humanity. Knowing that my care contributes to someone's well-being gives me a deep sense of pride and purpose. 20. How do you deal with end-of-life care? Show sensitivity and respect. Example, I approach end-of-life care with compassion and dignity. I ensure the patient is comfortable, pain-free, and treated with utmost respect. I also support family members by listening and being present. I understand this stage requires emotional strength and sensitivity. I follow care plans closely and communicate with the nursing team about any changes. My goal is to bring peace, comfort, and human connection during such difficult moments. 21. How do you stay motivated in repetitive tasks? Show enthusiasm and consistency. Example, I remind myself that every small task contributes to a patient's well-being. Even routine work, like helping with hygiene or meals, has a big impact on dignity and comfort. I stay motivated by focusing on patient satisfaction and teamwork. I also see repetition as a chance to improve efficiency and precision. Every day brings new people and experiences, so I never see it as boring. It's about finding purpose in service. 22. What skills make a good healthcare assistant? Show understanding of role requirements. Example, a great HCA is compassionate, patient, observant, and reliable. Communication is key. Listening to patients and reporting accurately to nurses. Physical stamina, empathy, and teamwork are also essential. The ability to stay calm under pressure and follow procedures ensures safety and quality care. Most importantly, a good HCA treats every patient as an individual, showing respect and kindness regardless of background or condition. These skills create trust and comfort in healthcare settings. 23. How would you support a patient with dementia? Show understanding and patience. Example, I'd approach with calmness and respect, using simple language and maintaining eye contact. I'd avoid arguing or correcting them harshly. Consistency and reassurance are vital, so I'd follow their care plan closely and report behavioral changes. I'd also encourage familiar activities or routines to reduce anxiety. Supporting dementia patients requires empathy, patience, and good observation. I'd treat them as individuals, focusing on their comfort and dignity rather than their condition. 24. How do you handle constructive criticism? Show humility and growth mindset. Example, I appreciate constructive feedback because it helps me improve. If a supervisor points something out, I listen carefully, thank them, and reflect on it. I don't take it personally, it's part of professional growth. For example, I once received feedback about improving documentation clarity. I took it seriously and implemented changes, which made communication smoother. Being open to feedback builds trust and ensures continuous development as a healthcare professional. 25. Why should we hire you? Summarize your strengths. Example, I'm compassionate, hardworking, and dedicated to delivering excellent patient care. I bring strong communication skills, teamwork, and reliability to every shift. I'm proactive about learning and following NHS values like respect, integrity, and care. What sets me apart is my genuine empathy and ability to connect with patients, even during challenging times. I believe I can make a positive difference on your team and contribute to the high standards the NHS is known for. And that wraps up our top 25 NHS Healthcare Assistant interview questions and answers. If you found this video helpful, give it a thumbs up and share it with anyone preparing for their NHS interview. Remember, confidence, compassion, and communication are your biggest strengths. Practice these answers, tailor them to your experiences, and you'll walk into that interview ready to impress. Subscribe for more healthcare interview guides and career tips. Thanks for watching, and good luck with your interview.